Why do people continue to suffer emotionally even when life looks normal? Why do some problems return again and again despite advice and support? Psychology not only explains these problems but also provides scientific methods to treat them. These methods are known as therapeutic approaches. Therapeutic approaches deal with the diagnosis and treatment of psychological disorders. Most psychological disorders can be treated effectively by using different types of therapies. The most commonly used method is psychotherapy. Psychotherapy is a voluntary and confidential relationship between a trained therapist and a client. It helps individuals understand their emotions, thoughts, behavior, and inner conflicts and enables them to adjust better to life. Nature and process of psychotherapy. Psychotherapy is an interactive process in which the therapist provides emotional support and guides the client towards healthy behavior. Different therapies use different techniques, but all aim at reducing distress and improving adjustment. Therapeutic relationship. Therapeutic relationship refers to the professional relationship between the therapist and the client. It is based on trust, empathy, and confidentiality. A supportive and accepting relationship helps the client express thoughts and feelings freely. The success of psychotherapy largely depends on the quality of this relationship. Common features of psychotherapy. All psychotherapies share some common features. There must be trust and confidentiality between the therapist and the client. Psychotherapy can be practiced only by trained professionals. All the therapies are based on psychological principles. The main goal is to make the client self-reliant and capable of coping with life situations. Goals of psychotherapy. Goals include motivating the client to resolve emotional problems, changing unhealthy habits and thinking patterns, improving communication skills, managing stress, understanding strengths and weaknesses, and making appropriate life decisions. Supportive and insight therapy. Therapies are broadly classified into supportive therapy and insight therapy. Supportive therapy strengthens coping mechanisms using reassurance, suggestion, persuasion, relaxation, and sometimes medication. Insight therapy focuses on understanding the underlying causes of psychological problems by bringing unconscious conflicts into conscious awareness. Now students, let us understand the first type of therapy, which is called as psychodynamic and also known as psychoanalytic therapy. Psychodynamic or psychoanalytic therapy was developed by Sigmund Freud. According to this approach, psychological problems arise due to unconscious conflicts, childhood experiences, and the interaction of the id, ego, and superego. Techniques of psychoanalytic therapy. Free association. Free association is a technique where the client is encouraged to say whatever comes to mind freely. It is also called the talking out method. Second, dream analysis. It is another technique. Dreams are considered the royal road to the unconscious mind. The visible part of the dream is called manifest content, and the hidden meaning is called latent content. Now let us understand the treatment process. Psychoanalytic treatment occurs in phases. In the opening phase, rapport is established. In confrontation and clarification, unconscious conflicts are brought to awareness. In interpretation, the therapist explains the meaning of these conflicts. Resistance occurs when the client avoids painful thoughts. Transference is a process where the client transfers pleasant or painful feelings onto the therapist. Through thorough working through these conflicts, the client gains emotional balance. Next, we move on to behavioral therapy. Behavioral therapy is based on learning principles. It focuses on changing maladaptive behavior rather than unconscious conflicts. Systematic desensitization. It involves gradual exposure to fear-provoking situations while practicing relaxation. Aversion therapy treats mental disorders using negative reinforcement. Token economy rewards good behavior with tokens that can be changed for desired objects or activities. Merits include economy, time saving, and nature, and effectiveness in treating phobias. Demerits include limited usefulness in depression and personality disorders and lack of long-term effects. Now, let us understand cognitive therapy. Cognitive therapy assumes that faulty thinking and irrational beliefs cause maladjustment. The aim is to change negative thoughts into rational ones. Now let us look at the subcategories of cognitive therapy. The first one is rational emotive therapy, known as RET. RET was developed by Albert Ellis. It focuses on changing irrational beliefs according to the ABC model. A is activating event, B is belief, and C is consequence. The therapist helps replace irrational beliefs and rational ones. Second, Beck's cognitive therapy. Aaron Beck developed this therapy mainly for depression. It was later applied to anxiety disorders, eating disorders, conduct disorders, personality disorders, and substance abuse. It focuses on correcting dysfunctional thinking patterns. Next, cognitive behavior therapy, CBT. CBT combines cognitive and behavioral techniques. It assumes psychological distress has both cognitive and behavioral causes. It is effective and economical but has a limited scope and ethical concerns in RET. Let us understand humanistic therapy. Humanistic therapy believes humans have free will and they have inborn tendency towards self-actualization. Carl Rogers developed client-centered therapy. The therapist shows genuineness, unconditional positive regard, and empathy to help the client grow and heal. Existential therapy. In this therapy, they focus on the present existence of the individual. Problems arise due to loneliness, isolation, despair, and fear of death. Logotherapy was developed by Viktor Frankl. Logo means meaning. The aim is to help individuals find meaning in life. Biomedical therapy. Biomedical therapy uses psychoactive drugs prescribed by psychiatrists. Dosage depends on the severity of the disorder. Side effects like addiction and memory loss must be carefully monitored. Electroconvulsive therapy, ECT. ECT involves mild electric shocks given through electrodes on the head. It is used in severe depression, mania, suicidal tendencies, and schizophrenia. It is not a routine treatment. Psychosurgery. Psychosurgery treats mental disorders through brain surgery. It targets the limbic system and frontal lobes. Though useful in some cases, it may cause serious side effects. Yoga therapy. Yoga originated in India and means union with the divine. Asanas improve flexibility, reduce stress, and improve concentration. Pranayama controls breathing and helps reduce anxiety and depression. Students, now let us talk about rehabilitation of mentally ill. Most disorders can be treated effectively, but severe disorders like schizophrenia, major depressive disorder, and addiction may show problems even after treatment. Such individuals may show loss of interest, lack of motivation, inability to handle stress, and exploitation by society. Rehabilitation helps promote recovery and social adjustment. Rehabilitation centers provide occupational and vocational training such as candle making, paper bag making, and weaving. Social skills training helps patient handle interpersonal relationships through role play and imitation. Thus, therapeutic approaches ensure treatment, recovery, and a meaningful life. If you have understood this lesson, please subscribe to my channel, like and share it with your friends, and also comment below your thoughts.